We are focusing on pediatric phlebotomy considerations for the phlebotomy exam. This topic is critical because pediatric patients are not just small adults. Their psychological and physiological needs require specialized approaches that are frequently tested. The core principle you must understand is atraumatic care, which means minimizing physical and psychological distress for the child and their family. On the exam, a question might present a scenario with an anxious 5-year-old and ask for the best course of action. While options might include restraining the child or proceeding quickly, the best answer often involves a combination of parental presence, clear communication, and distraction techniques. Involving parents and using tools like toys or books are testable components of atraumatic care. Another key area is pain management, specifically the use of topical anesthetics. The exam will test your knowledge of products like EMLA cream. A common exam trap is not knowing the required application time. For venipuncture, EMLA cream must be applied at least 60 minutes before the procedure to be effective. A question might ask, to minimize procedural pain for a scheduled pediatric draw, when should the phlebotomist instruct the nurse to apply EMLA cream? The correct answer will be at least 1 hour prior, using smaller equipment, like higher gauge needles and microtainer tubes, is also a crucial consideration for minimizing pain and the amount of blood drawn. The most calculation-heavy and high-stakes topic in pediatric phlebotomy is maximum draw volumes. The exam will expect you to know that these limits are based on the child's weight and are in place to prevent the serious risk of iatrogenic anemia, which is anemia caused by medical procedures. This is especially a concern in NICU settings where premature infants undergo frequent testing. You could see a question that provides a child's weight in pounds or kilograms and asks you to calculate the maximum volume of blood that can be drawn in a single instance or over a 24-hour period. Generally, the total volume of blood collected should not exceed 1 to 5% of the child's total blood volume over 24 hours. For example, a term infant's total blood volume is about 80 milliliters per kilogram of body weight. For an 8-pound or roughly 3.6 kilogram infant, the total blood volume is about 288 milliliters. A 3% draw limit would be approximately 8.6 milliliters in 24 hours. Knowing how to perform this calculation is vital. To help you remember these key points, use the mnemonic PALS for PEDS. P stands for parental presence and preparation. Always involve the parents and prepare the child. A is for anesthetics. Apply topical creams like EMLA with the correct timing. L is for limit. Always calculate and respect the maximum draw volume based on weight. And S is for smallest tube. Use microtainers and appropriate equipment to minimize blood loss and injury. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.